Good morning, and welcome to this week's episode of Ask Dr. Murphy. Thanks for joining us. Hope everyone's doing well today. My name is Meg Kennedy, and I'm a communications program coordinator with the Havey Institute. I will be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID questions each week on the Havey Institute for Global Health's Facebook page.
Good morning, Meg.
Today, Dr. Murphy. Oh, good morning, Dr. Murphy. How you doing?
I'm good.
Wonderful. Today, Dr. Murphy will be answering viewer submitted questions. So thank you to those of you who submitted. And he'll be addressing the latest COVID headlines through today, April 27th. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. I'm going to start with some updated COVID statistics for the US. In the US, as of today, there are 13,448 average new cases per day, 652 average hospital admissions per day, approximately 166 COVID deaths per day, and 17% new booster proportion. And that is from the New York Times and the CDC. So we're going to kick off with some questions from viewers.
Let me comment on that first. So yeah, it's
Right.
all going in the right direction. Cases, as you just mentioned, are really down. So the COVID deaths, when it gets to 100 per day of deaths, that equals what the flu does approximately per year. So that's kind of our marker if it gets down that low. And so, things are doing very well, and it's probably because people are vaccinated and they've had COVID, and the mixture of those two works pretty well, even though our booster rate is so low. So we have to be careful though and vigilant, as we'll talk about later in the presentation today.
Great, thank you very much. So we will now lead into some questions. Thank you to everyone who submitted questions this week. We had a few viewer submitted questions that we'd like to ask Dr. Murphy. So question number one, Nancy and Jean are wondering, do the at-home tests work on the new variant?
The good news is, yes, they do. So the new variant is very similar to what has been floating around for the last couple of weeks or months. It's changed very little, but it has changed. The virus is more transmissible, believe it or not. However, the tests work the same. So there's no concern there. Just keep using the same old test you always used.
Right. And then question two, Dr. Murphy, can you talk about current mask recommendations? We had a viewer who is in their 60s, has underlying health issues, still wears a mask in most indoor spaces, but is still nervous in crowds. For reference, this person is boosted and vaxxed. So what's a good guideline for them? When can they, as they asked, let their guard down? How do you feel about that, and what do you recommend?
Yeah, so I think what's happened is, the mask mandates have pretty much all gone away, except for mostly hospital facilities. And they have the option of, in public spaces in the hospital, to stop the mask mandate. There's so many immunocompromised patients in the hospitals that I don't think in the private spaces of the hospital that's ever going to go away. It's very unlikely, or at least not in the near future. So although the mandates have gone away, it's up to the individuals. If you're at risk, like this person is in their 60s and they have underlying health issues, they should be wearing a mask when they're indoors anyway. In public settings, most indoor spaces, because they are at risk for getting this, and it's still a very potentially lethal disease if you have underlying health problems, and especially if you're older. So this person is in their 60s, so they're a little bit older and they're immunocompromised. So this is now going to be a personal decision. And in most places, in the Illinois area, I don't see that as a problem. I see people wearing masks on the subway and in buses, and nobody seems to say anything about it. In some parts of the country, people are ostracized if they wear a mask. But that's not true here. So, I mean, at least, now it's a personal issue when you're out in public. So if you're at risk, you should be wearing a mask. It does help. And of course, there's a difference between the masks. The N95 mask works better, but it's a little bit hard to breathe in. It's so tight. But any kind of mask is better than no mask. So, and now it's all kind of a personal thing. One note is that just so you can see where this thing is going, there are still periodic outbreaks that are occurring. There was one in California at a Kaiser Permanente medical facility where there was a big outbreak. And so the mask issue changed out there. So you have to be vigilant and just see what's happening in your particular region and city.
Right. As someone who's in Chicago, I wear my mask on public transit all the time. And I find it personally comforting because there are a lot of strangers on there. And I don't want that. I don't even want their colds. Like, get away from me. I don't want any part of anything you're spreading my way.
And you never know who's infected. And, a lot of the infections are spread by people who have no symptoms. They're about to develop the symptoms. So that was one thing that caught everybody by surprise when all this, the shakeout came. So yeah, no, I think wearing a mask on the subway, especially the subways are getting more and more crowded now, and the trains are getting crowded.
Oh yeah, it's a nice line of defense for me personally. Great, thank you so much. Let's roll right on into some headlines. So I've seen the new variant. I know we discussed a little bit last week, but I've seen the new variant in headlines a lot this week. Can you talk a bit about that? What's changing? What's new? Anything we should be aware of? Any new cool details you have to share?
Yeah, so the new variant is called XBB.1.16. And it's becoming concerning because this is even more transmissible than the current one. I mean, everyone has to beat out whatever is out there. So it's of concern. So there's a big outbreak now, and it's accounting for most of the cases in India, the most populous country on earth now, also in Nepal. 31 countries are reporting this. It's spreading faster and faster. Fortunately, like in the question we just had, the same tests work to diagnose it, so that's good. It symptomatically, it's not any worse than the other ones, apparently. But there's a new symptom that's associated with it's like pink eye or itchy eyes. So that's kind of new. So people that have any kind of eye infection, they have to think that maybe they have COVID. So they should be tested for COVID. So the WHO has changed their recommendation from VUM, which is a variant under monitoring, close monitoring, to a VOI variant under of interest. So it's upgraded it because it is taking over. It's taking over all the COVID in the world. In the US, the cases have gone in the last week, it looks like, from 6.4% to 7.9%. So it's kind of edging up. And this is especially true in the Midwest, interestingly. So you just never know what's going on with this virus. It's always mutating. And, this is the next variant that's going to take over here in the United States. So we're going to have to follow it. That's the only real news about the variant. Also, the CDC and FDA have finalized their second dose of the bivalent vaccine. That's the new vaccine as of September last year. And they are recommending a second dose for people at very high risk for disease. Now, our uptake on the new vaccines is very low. It's only 17%. It's one of the lowest rates in the world. But particularly if you are at risk, you should be getting the new vaccine, which is what also called the bivalent vaccine. It's the one that's been upgraded to work better against Omicron, which is this new variant is still part of Omicron. And so a second dose is recommended, but not before 4 months after the last dose. So people that got it in September, October, November could be getting it again at any time, but I would do it particularly sometime between now and the fall. I wouldn't wait any longer than that. So that's the news on the vaccine. There hasn't been much really else big in the news lately about COVID. So that's where we stand today.
Great. Thank you so much, Dr. Murphy. It was very informative, as always. Thank you to our viewers who submitted questions and who interacted with me on our Facebook page and YouTube page. Always a delight to chat with you. We look forward to hearing more questions for next week. And Dr. Murphy, thank you so much for everything.
Yeah, we'll see you next week.
Great. See you next week. Bye, everyone.
Bye-bye.